Thank you, Mr. Chairman. Since we're talking about schools and COVID and money, I just want to remind the American people it was actually Democrats who provided more than $122 billion in funding to ensure K through 12 schools could open safely after COVID, and not a single Republican voted for it. So I just wanted to put that on the record. I want to thank all our witnesses for being here today and for the work that your centers do. The Centers for Disease Control and Prevention, or the CDC, has played a critical role to protect our nation's health from both infectious and chronic diseases since the 1950s. Dr. Jernigan, I want to start with you. I want to ask you about a program at the CDC that's the Climate and Health Program. Republicans have proposed to eliminate funds for the Climate and Health Program. It's a $10 million cut below the 2024 level and a $20 million below the 2025 request. Now, California has faced public health impacts from wildfire, smoke, and extreme heat driven by the climate crisis. And we've seen similar environmental harms to communities across the country. Can you speak to how these environmental threats, whether it be wildfire, smoke, extreme heat, or floods, affect public health and worsen the spread of infectious diseases?
Thanks very much. And with regard to the specific program, Dr. Bernstein in the National Center for Environmental Health, who's not with us today, it would be the best to respond to that specific question. But, you know, CDC is a health protection agency. And for me, in addressing emerging and zoonotic infectious diseases, I take into account multiple factors that contribute to the infectious disease threats that Americans face. The impact of weather is one of those factors. Flooding, loss of power from storms, elevated temperatures, these and other factors all contribute to infectious disease transmission, and we in our center are really looking at those consequences of climate. We're seeing that warmer and wetter conditions really support mosquito and tick breeding. That increases the chances for Americans to be infected with dengue, with West Nile virus, with Lyme disease, and other things. We also see increases in harmful algal blooms in waters in multiple states in the United States, and then also problems with certain kinds of bacteria that grow in warmer waters as well that might affect shellfish. So all of those things are factors that we look into as the world really is more crowded, it's more connected. The animals and humans worlds are converging, and climate is one of those components that's helping to see some of those infectious diseases increase.
So you talked a little about some of these, what to look for and some of the things that are happening. Can you talk a little bit about some of the ways that the CDC supports states to combat the rise of infectious disease in unstable climates?
Yes, so just to speak to what we in our center do, we have a long-standing support for vector control. Those dollars, about $26 million, go out through the Epidemiology and Laboratory Capacity Cooperative Agreement to state health departments, where it helps them to be able to detect, to pick up insects, find out which ones they are, and see if they're carrying these particular viruses like dengue and West Nile virus. That's how we're monitoring what's happening with the increasing numbers of dengue in the U.S. right now.
Great, thank you. Dr. Layden, I have a question for you. The Center for Forecasting and Analytics, or CFA, conducts advanced statistical modeling and analysis for the CDC with a focus on infectious diseases such as COVID-19 and monkeypox. Republicans' budget proposes to eliminate funds for CFA. Can you tell us if CFA was defunded, could you speak to how this would impact local health departments' ability to forecast and respond to disease outbreaks?
So I'm going to turn to my colleague, Dr. Walk, because the CFA actually reports to him.
Okay.
Thank you for the question. So CFA is the only U.S. government entity with the primary mission of providing infectious disease forecasts during a response. And since its establishment in 2022, it's been instrumental in advancing public health response forecasting and modeling capabilities for disease outbreaks, has contributed to multiple outbreak responses, including polio, acute hepatitis, mpox, measles, COVID-19, and actually launched InsightNet in September, which is a national network for states and locals to help them build the capacity for modeling and forecasting. CFA was very important for the Chicago response to outbreaks, and as well for wastewater surveillance, showed that integrating wastewater data yields more accurate forecast of hospital admissions for COVID-19. reducing funding for, or eliminating funding for CFA means that state and locals and the federal agencies won't have this important capacity to forecast and model in the future.
Great. It sounds like it's something we should continue to fund. Appreciate it. I yield back.